the AU Core Technical Design Group. So I've just hit record on the Zoom, so that will be recording. If you have anything to disclose or you have a problem with that, please jump out, but this session will be recorded. So welcome. We've got a jam-packed agenda today, very exciting. So I'll just flip to the next slide and kick us off, which is the acknowledgement to country. We acknowledge traditional custodians of the land on which we're gathered today. We pay respects to our elders past, present, emerging, and extend our respect to all Aboriginal and Torres Strait Island people, and acknowledge the first people as the first scientists, educators, and healers. I'm on the lands of the Ngunnawal people down in Canberra, and if you'd like to put in the chat where you're from, feel free to do so. So the agenda today looks pretty jam-packed. We've got our business as usual and updates that myself and Danielle will talk through. Then we'll pass over to Danielle for the AU Core R2 update. Then over to Brett for a discussion around the related person proposal. And then we'll talk about what's next meetings, face-to-face down in Adelaide, and I'll pass over to Danielle and Steve to talk through those. So on to our usual business, approval of minutes. Can I have someone please motion the approval of the last TDG, which was on the 23rd of January?
Neil, I'm happy to motion approval of the minutes. They're up to date and all the feedback's been incorporated.
Perfect. Thank you, Danielle. And a second?
I'm happy to second, Jamie.
Thank you, Jamie. Perfect. And those that motion is passed. Oh wait, no, I have to vote.
Yep.
Sorry, I'll put the poll up now.
You have your list of Friday.
If I can find it, here we go. And launch. All right, that should just have popped up into everyone's screen now, and I'm getting responses coming through, so I'll give that a couple of seconds.
Tim, just to let you know, we're seeing your
you're seeing my screen?
presenter's view.
Ah, scary. Apologies for that. I think I can swap that view around. Let me.
Yeah, should be able to.
Yeah.
Display settings, I think.
Screen 1. How about that? Thanks for that. Is that better?
Yep.
Okay, cool. All right. All right, I'll end that poll in 3, 2, 1.
Oh, +1 for me for affirmative, please, Tim.
Thank you, Danielle. We'll share those results there. So we had 21 out of 30 votes were affirmative, no negatives, and we had 9 out of 30 abstained. Thank you, minute taker. I'll stop sharing those notes. Perfect. All right, on to other actions. Noting that there was no actions recorded from our last TDG. We noted that there were 4 motions, 2 of which were minute motions and approved, and the other 2 were a motion around Ricardo being appointed as the chair, and also a I forget the other one. Apologies, I had it written down, which is in the notes of the last minutes anyway. So those only 2. Updates, news listed here. So as we all know through a lot of media attention, that AU Core 1 is being published, and you can get the details from the link there, followed with the implementation guide. So it's an amazing effort from the community there. Go to the next slide. Danielle, did you want to talk to the workshop?
Yeah, so we'll talk about it a bit further on, because it's actually our next meeting. So this is just a quick reminder there this is available. So our next meeting is a face-to-face. And if you haven't already secured your tickets, there's a QR code here. So just give it a couple of seconds. So snap that on your phone. And we are down, I think, to the last few tickets for the technical design group day. I think there's about like over 90 responding. Oh, there we go, Steve. Perfect. 19 tickets left because it's
19
a
tickets.
capacity of just a little bit over 100. And so we've already got the 101 registered. Thanks, Steve.
Hmm.
That's it.
Perfect. All right, moving on. If you need a link to that QR code, just one's on. Yep, can some people be reminded to go on mute? Thank you. Sorry, I flipped backward. To the next slide is the Trans-Tasman Symposium. It's sold out, I see. Oh dear. Still probably the ability to go on a wait list. So just email out to the events at hl7.au. You'll be put on the wait list there. It's a 3-day event up in Sydney from the 18th through to the 20th. The symposium being on the 18th and the Fire Connectathon on the Wednesday and the Thursday, 19th, 20th of March. Any further updates around that, Danielle? Can move on. Okay.
No, I think that's fine. I'm just dropping the email address in the chat for people who, if they already have a ticket but find out right up to the event that they can't make it, to give up their ticket that way, and how people get on the wait list so that as some people can't make it, then we can bring in some of the others. And also, it is a really good idea when you do that to advise what you'd like to join, because there is a symposium and work group meeting day, and then there's a 2-day connectathon there, and they are kind of separate things. So just let the event coordinator at HL7 AU know if you're looking to come to both the symposium and the connectathon, or just one of those. Yep, that's all from me.
Perfect. All right, exciting. It'll be a great event. Now over to yourself, Danielle, to talk through the R2 scoping workshop. Or, yeah, to report on it.
Thanks. Right. So I'm not going to spend a lot of time on this. We did a little bit last week, and this is just to finish that off. I think we can skip past this one and go, what we're doing now is just doing a really quick summary of kind of where things are at and how do we go forwards, which we're going forward today. Obviously, we're going to talk through the related person proposal that's been out for feedback for a couple of weeks. So I think we covered the focus for AU Core R2. So I think we're going to skip to next slide. Great. And so in terms of the workshop for new profiles, where we pulled from the backlog, so the entire day, what we did was we looked at our existing backlog. And that backlog's been formed from all sorts of decisions, both from where we've deferred ballot tickets, but also any time that someone's gone, well, wouldn't it actually be really good if we did this thing? That's always been captured and landed up in minutes or something somewhere. So there is this backlog, and there's a Confluence page for it. And we did a series of workshops on the day to try to work out, is there still interest in these items? Where do we really want to go to support R2 in terms of a maintenance release? And one of the things was new profiles. I think next slide, Tim, is probably the really interesting one. And of all the ones we looked at, and this is a table vote, so it was a table workshop. So in the room there were 7 tables of a max of 8 people, looking at what would be of most interest or relevance to do in an R2 sense. And so there was overall, I think we validated the backlog. And as we kind of went through these things, especially because the focus was agreed to be supporting e-requesting if they surface any requirements, and they haven't asked us for anything in specific yet, or to support patient summary, which did ask for a couple of things, what might we want to look at? And so that was kind of this overall ranking. I'm going to move through these pretty quickly, but if you're interested to have a look at them, we have all of these images and kind of the metrics and results from that day are available on Confluence. So I'll actually put that in the chat, the link to where the minutes are for this, which I'm about to do right now. There it is. So that's got this and some of the other kind of slides there. Right, so we've made a decision. If you go next slide, please, Tim. This is where we re-looked at that because, of course, we went, wow, that's, you know, not a surprise. There's overall a lot of interest to service all sorts of things, but what do we really drill down to that we think has to be done in R2 and we can kick off our work? And that ended up being agreed to be a related person medication statement. There was all sorts of really interesting discussion about others. But we went, look, these two first, let's do those, which we're also going to be working through today and through our next TDG meetings. And the others weren't first cabs off the rank, basically. Next slide. Oh, keep going. Right, then we looked at other things. We went, yep, profiles, that's a big ticket item, that's good. Let's look at all the other items in the backlog, some of which was AU CDI coverage we hadn't done yet. Some of it is overall like guidance or other JIRA tickets. Yeah, and then so we'll just show where there was interest. So we did some mentees and some table activities to essentially validate, was there anything here that people were interested in? Could we drop anything off our backlog because it's not relevant? And was there anything that we went, no, it has to be R2 and here's why? So if we just go through the next couple of slides, so probably just go to the next one. And this was at looking at AU CDI. Unsurprisingly, there was some interest by at least one table in the room for everything we hadn't quite done yet, including where we went, hey, there's a new release. So we looked at the brand new one, which was the patient summary draft that's been released for review. And I think it was no surprise that there was some interest on having work done. We didn't specifically end up agreeing to focus on any of these in particular upfront, except noting that we are going to be working on medication use statement as part of AU Core medication statement. So that is something that will be actively worked on. And the others will be looked at throughout the rest of R2. Next one. So we looked at some of the other bits, future candidate requirements, and there was still interest, except for the profile-only implementation guidance. There was interest in doing some work around this maybe. We're going to look to people who are interested to do work on that and then bring it back to the technical design group if that's what they want for us to consider in R2. But there was no burning need that it has to come in to R2. But it's something that we still have validated as being relevant and will, you know, continue to say that if we recognize that this is a potential pathway for AU Core, and we're looking now for the people who are interested in this, who have the capability and capacity to do that work, develop some proposals, and then bring that back to the technical design group. Next slide, Tim. And so that was really the workshop and the kind of discussions on the day. So summing up, focus is about supporting e-requesting and patient summaries they need. So we need to be prepared and flexible to kind of pivot if anything rises up from those groups. We also want to continue to work on AU CDI coverage. Right now, that's at least medication use statement. And then we'll look at some of those other aspects as we go. And also continuing to work on refinement of the existing AU Core content that we're now getting some feedback through implementation and adoption kind of decisions. The two new profiles that we're going to work on immediately are related person and medication statement, which, yep, brings in medication use statement. And then everything else if it's not being driven specifically from e-requesting and patient summary, it's going to be driven from the community needs. So we're going to, in future, at each of those meetings go, is there something in particular that we should be working through? We've got our backlog items, people have raised specification feedback, and we're looking for that to be driven based on people's priorities and needs to support their own implementations. Which I think leads me to the next slide. Yep, skip on, actually, because I think I've done that twice.
Yeah.
No, skip past this one. We'll come back to that later. Aha, here we go. So this is the how-to. So for those people who've already raised specification feedback and we've deferred to it or not gotten to it yet, and you think that this is something that we should be talking about, we're going to be putting out the calls pretty soon, I think, starting from the March or May meetings to be working through our backlog and looking for, if this is your issue and you care about it and you're prepared to come speak to it and do the work, we're going to be saying, what should we be talking about on our next meetings agenda, and just slowly work through those as part of the maintenance release for AU Core R2. If you haven't already created the JIRA issue and you have a new need, or again, you just haven't created the specification feedback, then this is the ways that you do it. Yeah, create an issue. So we've got a log of what you're asking for and why, and then email the AU Core co-chairs to say, hey, I'd like us to talk about this. This is important to get solved. We can schedule it for an agenda meeting with you and get you to come to that meeting and speak to your request, basically. And that's what we'll keep doing throughout the rest of the year. All right, I think that's it for me about where we are in terms of R2.
Yeah, nicely done. Thank you,
Thanks.
Danielle. And if you have any questions about that or any feedback, just pop it in the chat or reach out to us. But now I'll hand over to Brett to talk through the AU Core RelatedPerson proposal.
Thanks,
Brett.
Tim. Thanks. Cool. Yep. So this is what we're working on today. So just to give some framing, we've had some background meetings, some feedback opportunities in the last couple of weeks, and this is kind of bringing it to the group with the outcome of that work. So what we're looking to do is to work through the addition of a AU Core RelatedPerson profile. So that's really for our R2 outputs, and also makes it available for Connectathon use. So yeah, we'd really like to have that available ASAP so we can move to maybe even the March Connectathon with some material to work with. So just to reiterate what AU Core profiles are about, we're really looking at the kind of minimum expectations on data and interactions. So this is really helping set a common understanding as to how systems are going to operate, with a really basic set of features that we can all agree on, and hopefully achieve a good result with that. So this is really just applying the same kind of methodology we have for other profiling we've done in AU Core. So nothing special about this profile as such. We've looked at other specifications implementing RelatedPerson profiles, and also a CDI, which there is no info for RelatedPerson and CDI because it's not clinical. We've had an opportunity for some feedback, so there has been some feedback come through on a draft version of the RelatedPerson profile. So that's been incorporated and addressed in what's going to be seen today. And we also have some pre-agreed things on RelatedPerson which do affect the profile that's being presented. So we'll hit that along the way, because that's something that was actually decided already in committee. And so really, like, we're applying the common approaches to all of this material. So we've used similar approaches for similar types of elements that we have in other places in AU Core profiles. Similar requirements on the search parameters and content there. And we intend to apply the same obligations and missing suppressed data rules that we've applied everywhere else. So we don't see any kind of need to do anything different around that. So I might move on, Tim.
Yep.
So I'll just ask if any questions on that as such. No, that's good. Cool. So initially, like this proposal is kind of broken down into multiple parts. So initially, just looking at the top level elements in related person and how they what the must supports are around those top level elements. So you can see there's a selection there to look at. So initially we're looking at patient relationship name, telecom, and address as being must supports, and that's kind of a pretty commonly used and available set. It should be noted that related person has many different kinds of usage, so we do need something that's pretty flexible, as well as being something that is there's some expectations there. So depending on the use case, these are the kind of elements you'd expect people to use and make available. So you can see patient is mandatory, and you can see which you kind of expect because it'll be related to somebody. And the invariant at the bottom there listed has a requirement that either or both of name element or relationship element have to be present. So you'll either know the name of the related person or the way they're related to the patient, or both, right? So there's some requirement there we expect one of those elements to be included. I think that, and that's really just kind of covering the minimum data requirements to ensure that there's some ability to identify who is being related, either by their role or their actual name. Yeah, so I guess having said that, and now there's a proposal related to this on the next page, but is there any comment on anything so far? Dan, stand up.
Yeah, I'll comment on the proposal. I'm quite happy with this as a starting position. I note that for related person, and one of the reasons we've put out the proposal so quickly is, of course, we had a early draft of AU Core RelatedPerson when we were doing R1 work and got some feedback on it. And this is kind of an update to that. I'm comfortable with the changes from that, which it was a lot stricter. The very original version had a lot more mandatories of things, and based on what I've seen, the feedback and the information session we had last week, and people commenting of, yeah, you might not know this circumstance, and you might not know name here, you might only know that they're related. I'm quite comfortable with us proceeding with having only patient is definitely mandatory and keeping the kind of conditional rule that you need either name or relationship, but you might not have both. So I guess that was my comment, that I'm happy to support that and then take that through testing and review and see if we need to do anything further on it.
Thank you, Danielle. I think I'm in the same boat as you, so I'm not going to reiterate that, but I think that was a very, I think that's very reasonable. Is there anyone else with any questions or comments?
Sorry, I can't find my raise hands button. Can I speak?
You sure can,
Yeah.
Stephen.
Thank you. I think that the relationship cardinality of optional might need to be reconsidered for the reason that what is the point of defining a related person without actually knowing what the relationship would be?
That's a good point. Yeah. So you're saying in the event of a oh, sorry, Brett, you go.
No, yeah. I get your point, Stephen. I think there were cases that we talked about, especially on the info day, about cases where there were related persons being used in records that, for things like witnessing and other things where the actual functional or kind of personal relationship information wasn't available, and really you're using that as a method to be able to refer to another person by name, and that was one of the cases. And I think that's kind of where that invariant came from, to make sure you've got some relationship or some name attached to the
So we're
entity.
saying that you can have a named person, and yet you can say that this person is related, but we don't even know how it's related. Does that even make sense?
Well, yeah,
Yeah.
and I guess I was going to say, well, yeah, if that's the data currently in systems, and that it's still meaningful to represent that something is witnessed or otherwise, and say it's this person, like we know their name, we've got their address in telecom, we can uniquely identify them. I can't specify whether it's a family member or an employee or an employer. If that is still meaningful in some circumstance, then yeah, and I heard some of that, like workers' compensation and other things like this, where yeah, that actually is that is the case. And I will note though, and it is sort of to that point, Stephen, that if you do know the relationship, you need to supply it. That's what the must support in AU Core is. So if you happen to know the relationship, you have to supply it. It's only if do we avoid sharing that information at all if you happen to not be capturing that? And I don't think we have to say that for every single use case, I guess.
Okay.
I think one thing about the resource related person is the name is slightly misleading, because you think, looking at the name, that it's a person related to the patient. But when you look at the description, it's just a person that you want to put in the health record. And so they're related to the health record in a sense, rather than related to the person. And the relationship is about their relationship to the person rather than their relationship to the health record. And so there'll be those edge cases that people were talking about where it is unlikely to be known.
Yeah, it's a good point, Richard. Like in our conversation we were having on this yesterday, we were basically saying a related person is any person that might be, attesting or whatever, that is not a practitioner, not the patient themselves. So they're the other.
Yeah. So
they could even be a practitioner, but they're not acting as a practitioner. So if my neighbour is a doctor, and not as a doctor, but just as my neighbour, they provide useful advice of some sort where we want to record the source of the information, then they'd be a related person because they're not in a practitioner role in my health record.
Exactly.
Excellent. So I think it sounds like people kind of have some background there. And I think it's worth, I think David's comment to, terminology. There is a terminology set inherited from AU base. So we do have a coding value set that's applied to relationship. And I think there's no, that would be an AU base issue if we were going to change that. So, by all means, have a look, but we won't be talking about here.
If I could just quickly jump in there, because that was an interesting last little comment about talking about my neighbor as a doctor. They came in and provided some advice. Now, I'm not completely familiar, but I thought this was more about, there was Bob came and visited me and so there, I'm kind of keep track of who's contacting the patient, not necessarily, oh yeah, here's the neighbor who's a doctor who gave us some medical advice. That's got to be another message around bringing that sort of detail in.
Wait, I mean, you can, one of the codes is neighbor, one of the codes is employer. Some of them are natural mother, like we're not prescribing what your usage is. I guess it is defined here that if you have a need to share that administrative data or to capture it, here are some of the rules around that.
Yeah, because the way, like, that relationship kind of exists as a personal or functional kind of relationship, and they'll be referred to in the record as an information source or a recipient or a witness or some other kind of role that that they're filling in the record, but they still are under that functional or personal relationship all the time. Yeah.
And I think you
point
nailed it there when you said administrative, and it's not a clinical angle, even though the example that we were got into. Yeah.
Exactly. It's irrelevant that they're a practitioner in this particular context. All they're doing is helping out the patient fill out a form or whatever, along those lines. They might have taken their blood pressure for them, as an example.
Julian.
Shoot to Julian.
Yep.
Yep.
Just speaking from a past point of view, all right. When we talk about related patients, we're not gonna put in neighbor and stuff like that unless the neighbor is the next of kin or they have their power of attorney or something like that. We're not gonna capture any of that as a related person. So I'm not sure why we want to do anything like that, but I do agree with Stephen that relationship should be a mandatory. There should at least be one. You can't send a related person without a relationship. They have to be something to the patient.
But does your system capture exactly what that is?
Yes.
Like it, and does every system for
every
all
pass
use
will
cases?
capture what the relationship is. It will never let you just create a random person that you don't know what they are to the patient, be it child, mother, daughter, next of kin, whatever. It can't be just nothing.
But if you're attesting to an allergy, or something like that, there's so many use cases around the use of related person
I think that's
in the record that not every system always records the fact that they are the neighbor that actually took the blood pressure. It was perhaps a nurse or whatever, but you might just enter in their name free text.
You won't enter that as related person.
Yes, you will. You have to. There's no other way to do it. You can only if you're actually capturing in fire that someone was the information source, they'll either be a practitioner or a related person or the patient themselves, basically. So
maybe show an example. Maybe show an example of a resource that would use related person as the information source, so that you can see that from the point of view of the source that's using related person, all you're interested in is their name. You're not actually interested in any of this other stuff.
The mean consent is a good example of it.
Exactly. Yeah, that's a good
example.
example.
I guess what we really are, so I think everyone has agreed that relationship, if it's known, is really valuable. The only thing we're saying is, are there meaningful use cases where systems might not have been capturing this? I guess that's really what we're arguing about.
There's definitely, in the use of consent and consent, say a document, say composition as an attester to a document or something like that as a witness, you may want to just list their name, right, as the witness, or a name and address. And that's pretty typical, I think, for a legal document. And then you start to ask questions about PI, because why would I share the relationship if I don't need to share a relationship, and things like that. So I think it's that's to try and maintain maximum flexibility. That's why it's optional. And it's kind of included there.
And to reiterate, it's basically, if it's there, you have to provide it.
Yeah.
If it's recorded, you need to provide it. So it's as good as mandatory if you have it.
Yeah, for a regular sharing case, unless it's suppressed, right? And if you suppress it, you don't need to provide it, which is exactly what you want to do. You don't have to put missing data.
This is the person that saw me fall down the stairs.
Yeah.
Could be. I think the point of the related person is it's as flexible as the data from those source systems and putting in. So those use cases could be very broad. Could be an allied health person that has no relationship with the patient, but happened to be there and cared for the person who may have fell down the stairs, or not directly related, but or even the organization.
And it's also if your system always has it, then sure, populate it. That's good, and you're obliged to anyway. But it's also requesters, I think, can expect. It's expectations for the people receiving the data as well. So this is just really highlighting things you can expect to be there, maybe, right? And they're not guaranteed to be there for a relationship. Yeah.
So I'm just conscious of time as well. And we've got a few more of these
so
detailed discussions in this.
I guess, I guess go ahead.
I motion that we accept this as is.
Cool.
I'm happy to second. I'm happy for this to be our starting position for a draft related person. Yeah.
Perfect. All right. Do I ask for feedback and comments, and then we'll launch into a poll?
Yes.
Yeah. So anyone has any further comments or would like to provide any feedback? If not, I'll jump into a poll and we can vote. Oh, Andy, you've got your hand up.
Yeah, sorry, I'm just getting off mute. Just to note that unknown is a valid code. We just talked about missing data. Do we want to say something about, you should, because if you made it mandatory, you could just say unknown. So that I just kind of throwing some petrol on the random fire about. But given unknown is a valid code, it kind of begs the question.
Love the pun.
So are you proposing a friendly amendment, Andy, to make relationship mandatory?
No, I'm simply saying that we need a position on the use of unknown in this, and it's not clear to me at the moment. We've kind of put it forward as a bit of a random kind of do what you want, and that's very confusing.
I think
unknown is also present in other elements. I don't think it's any different for this one than some of the other things.
I think it sits in the missing data suppression rules already.
Yeah.
Yeah.
Richard.
For mandatory it does, yeah.
I'm troubled by having other as a code. Unknown always is problematic. I think these are AU base issues rather than AU core issues.
Yeah,
and we should probably raise a thing saying, hey, look, you guys looking after AU base, tidy this up a bit, please.
Yeah, I would welcome that for Firework Group to have input on that. And look,
could sound like a ticket that could be created.
Could be.
Yeah.
All right, back to the motion.
Back to the motion. Did you want to show the next page before I jump into that vote?
No.
Let's not worry about it. Let's just agree on this.
If there's no friendly amendments, the motion has been motioned and there's a seconder.
Yep. So I'll just launch that vote there. Should pop up for everyone. Can see people are voting. Give it a couple of seconds.
I do, I guess, want to also stress while people are voting that doesn't mean that we can't tighten or relax the cardinality of any of these things or apply any further rules or must support later on. I think we're starting from a position and then we're going to go through and refine it like we have for all the other profiles.
Yeah, I think we'll have the opportunity to test it, connect the funds, and we'll definitely be balloting it as well. So there'll be good opportunity, I think, to weigh in on further concerns.
All right, I'll close the poll in 3, 2, 1. All right, so you shall see a results pop up shortly. The numbers look like 27 out of 37, so 37 the total, 27 out of 37 affirmative, 3 for negative, and 7 abstain. Plus, Danielle, did you want to vote in the chat as well?
Yes, plus 1 affirmative for me.
Plus 1 affirmative for Danielle. That's 27 out of 37, 73%. I think the motion has passed. Stop that.
And you can skip the next slide. Tim, don't have to look at that one.
Right.
All right, so
the next one.
now we've moved move down to where there's some further constraints on name. So this is the related person name element, which we've just already included at the top level. But under that, we do have the parts of the name which are spelled out there. So this is very similar to the patient, AU Core patient structure for usage for name. So similar support requirements, and that was intentional. There is an invariant added to that around using requiring one of the parts of the name to be present, because it's not much fun to have a name that has actually no name content in it. So either text, family, or given must be populated, and it's actually required. It's a mandatory element, one of those, at least one of those. So you can populate all of them or part of it. So and I can say use was included as part of a previous decision around supporting gender harmony content. So that was especially for name to use, which is part of the advice on patient names. So the ability to say what a person's preferred name is as part of the information. So again, these are optional elements, so there's no requirement to provide any particular one of them, but there is a requirement to provide one of the name content elements. That's probably all I have to say on that. So just see if there's any comment on.
Would you like me to flick to the next slide, or?
Well, let's just get some general comments and see. I think.
Is that someone talking?
Sorry, Danielle, I'll put you on mute.
It's not me. I just went off mute to try and say the same thing.
Right. Okay. I have a comment about name. If we have a standard set of constraints and obligations that we want to put on human names, would it be worth having in an Australian name profile, a profile of the data type name?
They are different. So practitioner name doesn't have these. So they have a different set of rules.
Okay, look, if we've got several sets of rules, then it's not a particularly useful idea. So fine, good.
I mean, we might find time as we go on that if we agree on exactly the same set for related person, that it's then cheaper to manage that as a profile. That could make some administrative sense, assuming we do actually want to, that we agree, I guess, which is what the proposal is now, is if the same rules we've decided for patient are being proposed as they're applicable to related person. And I guess if we decide yes, that could be an option. You're right.
Yeah, we can do that in a year or so as a piece of refactoring, but it's not something to do now. Thank you.
That's awesome. Were there any other things to mention? Okay.
I'm happy to motion if we're up to that, we accept this proposal.
Perfect. So, Ruben, sorry.
Sorry, I should remember this, but I don't right now. But is related person meant to model a baby if a mom has just had a baby in hospital? Is this the resource we use?
It can.
Could be.
So in that case, I'm wondering whether
it's the use
we
case.
need some kind of identifier or element to indicate that the name is actually. Well, I suppose it's temporary if it's baby of or something like that. But could we have something a bit more explicit to indicate that this is an unnamed baby or something like that?
I think the idea is that a new baby in the mother's record is a related person, and in the baby's record is a patient. So you've actually got two. They've actually got two systems rather than one. Rather than having a new effective patient in the of the baby in the mother's record. I think that's the idea.
I would welcome that use case to be addressed in a child digital health record.
That being said, I was going to
yeah.
say, I think it's an interesting idea, Ruben. And I think if there is specific, like profile specific implementation guidance for cases, I think that sounds great. And I think the way to do that is, I guess you're proposing some profile specific implementation guidance, and then we could
I think
add that in later.
Yeah, I think that is a later tracker item. That's right. I just wanted to know if it had been considered as part of this proposal as yet.
Which
it'd be good to have that guidance drafted and see if there's anything, like, if it has any effect on the profile itself, would be kind of the thing we want to know.
But I think the question was around use, wasn't it, Ruben? Which I think you answered yourself, that it's probably temporary.
So use is kind of locked down, and it's we can't change. I think that's a required binding. So temp will obviously cover a whole lot of temporary use cases. So I'm wondering if they wanted something specific around babies.
Yeah, I'd like to, if there's a well-known, and it sounds like you've got some of that maybe from Queensland Health or wherever else, I think that sounds really good to bring those in, and we can discuss that and socialize and go, is that consistent? And then if we go, actually that is consistent, we can then add that to the profile later on.
Okay, sounds good.
Go to Kathleen.
So there's a fairly consistent process. There is some variations, unfortunately. Most babies are baby of the mother and not the father, but baby of, and then they're relatable. But if they're a twin, they'll be twin 1, twin 2. If they're a triplet, they'll be triplet 1, triplet 2, triplet 3. So they're all named a little bit differently. And I know that Queensland Health would have something, but most of the organisations follow that generalised way of naming them until they get the real name.
Thank you. And Julian?
Just related, but so New Zealand has done something similar where they did for their file implementation for babies, and they put an extension for name use. Now, I don't know if we're going to do the same thing, but just bring that up. Where they have specifically as an extension name use, and they have baby off. That's what they've done.
That's noted.
That's interesting.
I think that's going to be one of the things on why it's worth actually going, let's do a specific piece of work on this case and discuss it and take the time to put that together. I think that I didn't know that had happened there, and I think that should be the kind of thing we're also considering when we have the discussion about it. Yeah, that's really interesting.
And probably you still want to populate the use element as well as indicating they're a baby of, because that is the standard stuff, right? That's in the use element. So systems that aren't aware of the profile. Yeah. Kathleen.
Is that a old hand, Kathleen, or did
it's just the other thing is and it may be of no use at all, but then when that baby of record is updated to be Jack Smith and it's no longer baby of Kathleen Rogers, that's where the identifier might be of use, because how do you match them to be the same thing as before, just to complicate things.
Yeah. The administration side of baby ofs and birth records, my time in public service and knowing some of the administration processes that go behind the scenes just does my head in sometimes. So it's worth a very good conversation, I think. But noting that, is there any other comments or feedback on this particular proposal? And
sorry, just one more thing. I know we said that text and that it says that should have at least text family name or given name present. Is it possible to just make it, because this is consistent with what we're with how Medicare treats it, that if you only have one name, it's always the family name and never the given name?
Ooh, I don't think we could go that far there. I think we can with patient, but because we're not linking in related persons, I I don't think that's going to be the case for every use case. We're going to end up with related person. I wouldn't feel comfortable with going that far without us then testing it out and trying to prove that that's what's always happening.
All right. Okay.
I think the rule around single name going into family name is most often applied to people who have only a single name. So in some countries, I think parts of Indonesia, you have a lot of people who have only a single name as opposed to a given and family name. And that the Australian standard for naming such people or for allocating such people's names into bureaucratic systems is to put that single name into the family name field. But that's based upon you knowing that that is the person's single name. If you don't know whether it's a single name or all you know is a given name or all you know is a surname, then your best option is text, because you can't actually categorize it as family or given or single.
Yeah, and over to you, Kathleen.
Yeah, I do feel like we need to explore when there is only one name, and sometimes it's a given and sometimes it's a surname, and how we capture that.
I agree with Richard that I think the default advice, and that's also in fire as it goes into the family field. I think the cases we're also saying your system might actually have the full thing, like Mr. Silly Wobbles or something, and that's the full thing. They just don't have it machine separated into different fields. In which case, what you supply is name.txt, because you've got the full name there for somebody. And for a lot of related person use cases, that's fully satisfactorily to name a related person.
Yeah, it'd be good to think about, because even as guidance, it would be interesting to have that, as to how to approach people with one name. And have
I personally think that this is at a higher level, this guidance. This is like AS, I don't know, 50 something or other, blah, 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 like around identity.
Yep. Classics.
This is a technical specification, and it really comes down to the implementation. And from an interoperability specification, all we can say is, if you've got these three ways of recording names, at least one of those has to be provided. Otherwise, this is just silly, and you have to put missing, treat name as missing data or something along those lines. So, I think we're getting a little bit bogged down on this particular one.
Yeah,
I think that's right, Heath. But I also want to flag that Stans Australia spec hasn't been updated for probably 10 years or longer. And so we don't actually have a good reference like that to address some of these issues. So just flagging that's an issue.
But that's not AU Core's business, as I guess
it
is what I'm
isn't.
trying to say.
It isn't.
So my motion still stands.
Yep. Okay. I'll call for the motion if we think we've.
We need a seconder.
Locked it. Yep. So a second.
I'm happy to second, Josh.
Thank you, Josh. I will bring the poll up now.
I'll second.
I've got Josh's, but we'll add you as a third. All right. Oh, let's go relaunch. Continue, and that should appear for everyone to vote on now. Some great conversations in this. I think this is going to take us a while to get through, but yeah. I certainly would be interested in knowing what source and receiving systems would do with a single named user, especially on the comment of the bureaucratic system side of being locked into a family and given.
Error.
All right, so I'll give it a couple more seconds in 3, 2, 1, and I will end the poll. Oh, one last one came in. I'll end that now. The results are being shared. So we have 40 votes there. 30 of 40 are affirmative, no negative votes, and 10 abstained. And Danielle, do you have a vote?
I do. Yeah, +1 for me, sorry, into the affirmative.
to the affirmative. So 31 out of 40 for the affirmative, no negatives, and 10 abstains. So I'll stop sharing now.
Right. So thank you. I think we can skip the next slide then. Those ins and outs of the feedback on that slide.
Yep.
And so this is so that's the profile. So well done. Got a profile. So now this is interactions support. So really looking at the basic interactions to be supported with this data, and also the search parameters to what level of support we're kind of seeking around using the related person profile content. So at the top, we've got the overall resource type interactions, and these are exactly the same as every other kind of health piece of data in AU Core. So hopefully these are not controversial, but you should be able to read the related person content and also be able to search with it. So hopefully that's pretty straightforward. That's similar to pretty much every other profile in AU Core. And then we've got a list of search parameters. So the approach here is that we've essentially aligned this set of search parameters around the similar approach to other parts of the AU Core. So we have a shall parameter on patient, so being able to support searching by the patient. And we've also got the same more detailed requirements as other AU Core profiles. So being able to search by the resource ID in a particular way, and also being able to search by patient identifiers. In a similar way, explicitly IHI, Medicare number, and DVA numbers. So they're the ones that already exist in the patient profile. So we also have a should support ID search. So that's being able to search by ID for the related person, and shoulds on combined patient relationship and combined patient and name searching. So they're the core things. The may relationship has been added for name and relationship alone, and that's so we can also have a specific constraint on if you do implement the relationship only search. There are some extra requirements which are also common requirements across other token searching in AU Core. So I guess I'll open the floor there. So probably the big ticket items are the shoulds on the combined patient relationship and patient name, and whether people kind of, how people feel about those.
Landon, to you.
Oh, thank you. So with the maze, because we often don't usually represent maze, is that purely for that conformance requirement around the shall is why we would specify it here?
Yeah, so it's a standard editorial practice for anything that we've got in search combination, because for things where we have search combinations or otherwise, for the parameter type, so like token, there's a standard set of AU Core rules for tokens when you support a token search parameter. And what we do is we put these in a table and we advertise for everything we've gone should, we put them in the table, those particular ones. So if that's patient plus relationship, and assuming we hadn't done shall for patient, you would see patient as a may and relationship as a may. And that allows us to clearly describe for implementers what, if any, rules when you support that particular parameter are applicable in AU Core. And you can see there for relationship, which is a token search parameter, has the standard set of token rules applied to it. String doesn't actually have any standard further requirements on top of Fire's definition of the string parameter. So that row is blank. And that just lets us be really clear that everywhere we would use relationship, and let's say there's more than one search parameter combination, you would know what the rules are for the use of that parameter.
Yeah, and as a technical thing, like in the capability statement, we need to include them so the capability statement knows what type that search parameter is. So as a technical thing. So
okay.
yeah, so whilst we have nothing extra to say about the name search parameter, because it's always may, because that's the definition of the Fire definition. Yeah, we do include it so that the capability statement can be complete where we use name in the patient and name. Yeah.
Because what I get is if we don't write maze, then I'll get questions on, but are there any rules on that particular name? And it's just easiest to present that in a discrete kind of table, basically.
Perfect. Thank you.
Yeah. And being may, you don't need to implement them as single search parameters. Yeah. So
yeah. Thanks, Brent. Thanks, Landon, for the question. Anyone else with any questions, comments, feedback? If not, I will call for a motion.
I will move to accept it since I wrote it.
So motion, Brett, thanks. And a second?
I'll second.
Thanks, E. All right, I'll pop the poll up now. Click, click, click. Relaunch. There we go. That poll for the current proposal is there, and votes are coming through.
I'll preempt, so you don't have to ask me at the end. +1 affirmative from me.
Thank you, Danielle. No, +1 affirmative for Danielle. Right. Those have come through. I'll end the poll in 3, 2, 1, and share the results. So we have plus Danielle's vote, 30 out of 35. Got no negatives, and we have 6 abstains. So perfect. That motion has passed.
Lovely. And yeah, you can skip the next slide, and I will wrap up by saying thank you very much. Yeah, so obviously now we can go ahead, look at drafting this proper into the specification, and we'll go through all the QA and things to make sure it's all making sense. Danielle, did you want to?
I just wanted to re-emphasize, we've got some good feedback about some further things. I'm fully expecting us to be talking about relationship again and cardinality and maybe some other stuff. So around relationship, there were 3 negative voters on the proposal, which I think is really exciting foreshadowing for a May agenda for further spec feedback, and also there were the really good suggestions about saying that we could add in some guidance around the use case around baby names. And then I think there was the potential for some other kind of name discussion, whether that I think sits at maybe a higher level around names. So I just really want to encourage what I was saying earlier about how we do this to go forwards is, so we're going to be taking the draft, to the Connectathon. But if people have specific proposals, like if you're happy to put together a proposal on how we could do baby name, you can either create a JIRA and say, hey, this is ready. And we can start as co-chairs putting out the agenda for the May agenda just after the Connectathon to be working through our refinements on related person.
Do you think it's worth having a breakout at the Connectathon around names and using names?
Could be.
We could.
If there's people on the line, and I guess that's if you've got capacity over the next 3 weeks or so to be putting together a proposal and can come to the Connectathon, we could hold a session on that and try to get some further feedback and bring that back to the TDG. Yeah.
Yeah, and I think part of it will be what should AU Core do and not do in regard to that information as well. I think because it's like it might be just informative, but you know, does it need a place to go? Is it should it be an AU base? You know, as well, like in terms of that advice, because it's maybe it's at that level. So I think having a discussion though would be helpful.
I must admit that we were talking about when you're talking about babies, we were talking about ages, and you know, right now we're always looking at ages a year, and I'm thinking, well, what if they want to start, 3 weeks or 17 days and stuff? So it's almost like age unit of measure. Like, is that in the standard as well? We were sort of getting around that too.
Cool. Anyway,
Hours, yeah.
I think we have achieved what we needed to achieve. So thank you very much, everyone.
Fantastic. Thank you, Brett. Thanks for all the discussion points there. Over to you, Danielle, for next steps.
Oh, yes. Next slide. Okay. So what's coming up? So there's a whole bunch of just optional information sessions. We had a little bit of a poll and a discussion in our last TDG if people were interested to hold information sessions about the fire resources and the profiles themselves before we did voting on and feedback on proposals, similar to what we've done in R1, and there was quite a bit of interest on that. So we've agreed to put those together. We did related person, and that was a really interesting discussion about when would you use related person versus something else, and what do people use this content for. That helped, I think, inform both the proposal and people feeling comfortable about what would it do if we used it, basically. And so we've got a few more of these. Our other profile we're putting into AU Core R2 up front is AU Core medication statement. Like related person, we had a draft in R1. And so that's just going to get picked up and polished a little bit and then put out for feedback. And we're going to run a number of information sessions. I'd originally sent out an email saying, hey, there'll be one info session on med statement. Let's then do one on dosage, because dosage is complex enough as a fire resource or data type that you need to spend some time on it. Consequently, I've gotten some feedback and people have said, hang on, I think it's worth having 2 sessions actually around medications. So based on that, the schedule's changed a bit. So we're now going to offer the fortnightly Friday info sessions. So that's the 14th of Feb for medication statement. Another one on the 28th of Feb, which might continue the same discussion, or it might just be a new crowd, who knows. And then dosage on the 14th of March. Our actual decision-making points are on the bottom row. So we've got our next meeting is the 20th of February. That's the face-to-face in Adelaide as part of the CDG Day, TDG Day. Steve will talk about that shortly. And then we have a call on the 6th of March. That's our next virtual call where we're going to do what we did today, but around medication statement, basically. And then there's the Connectathon, the Symposium Connectathon. The first day of that is also a work group meeting day. So we'll be having our work group meeting, or what would be the fortnightly call on that day. That one's hybrid. So if you're there in person, then hopefully you're in the room or you're in the symposium. But if you can't make it there in person, then you can dial in, and we're working with the event people to make sure that dial in works and you can hear us. We've had varied success in the past. Sometimes it's worked really well, and then other times it's been really hard for people on the line to hear. So hopefully you're with us in person. Can you go click on the next to trigger the next bit? I wanted to recover for people information sessions. These are really informal, and if you've got questions or things you wanted to bring up, whether it's implementation topics or terminology, or go, what would you even do with this? come along to those meetings. It's really, we're just carving out some space, and we'll have a facilitator on hand who feels comfortable talking about that fire resource. And it's going to be kind of guided by whoever's there and whatever the questions that come up are. So please go to one of those if you have any questions or interest in talking about medications and how it relates to AU Core or Australia. Next one. Okay, so talking about meds, like with Related Person, we are sending out the draft. So that initial proposal, that should be next week. Like with Related Person, there'll be a draft, it'll be in a branch, and we'll go, you can click here and you can see what the proposal we've kind of resurrected from AU Core R1 looks like. And there'll be a feedback page on Confluence where you can go through and say, oh, I think you're missing this, or we should change that terminology, or we should add these things in. That'll be monitored and responded to. We'll probably kind of talk about that maybe at the information session. And if you have any questions about the proposal, you can post those in the chat.fire.org topic for AU Core. So yeah, that'll come out via email. It'll be part of the minutes and next meeting email where there'll be links off to this, and we'll also do an announcement post on chat.fire.org. Next one, which brings me to dosage. So dosage a bit different. We didn't have a standing profile that we're resurrecting from R1, which means we need to do the work, I think, to work through what should that be before a proposal comes out and then gets feedback on it. So I'm going to put the call out to say, if you're interested and you have the capacity over February, March to work on that dosage profile to then come out and back to the TDG to then put voting and feedback on, can you email us? We've got the aucore@hl7.com.au there, and we'll bring you into those discussions on, I think, getting to an initial position. I think that's it for me. I just wanted to talk through that's coming up. I guess actually, no, sum up. The reason I've been mentioning May of now let's do refinement and backlog kind of content is because we've got the AU Core RelatedPerson through to bringing in medication statement. It's kind of like scheduled now up until the March Connectathon. And then I think we're going to go through any of the feedback and additional items. Some we talked about today, others will be further work from May onwards. All right, that's it. Thanks, Tim.
All right, thank you. And over to Steve. Oops, I've just clicked something I probably shouldn't have. Let me just do that. Yeah, Steve, over to you for update on the Adelaide.
Yep.
Face-to-face. I am hoping I'm sharing the right slides for you.
Okay. I can't see anything at the moment. Oh, wait. Oh, here we go. Yep, it's the one. Great, thank you very much. So Adelaide face-to-face TDG meetings on the 20th of February. And so two major topics of the day will be a discussion around medication exchange in both AU Core and AU Patient Summary, talking through some medication use cases, how various systems represent those medications. For example, clinician prescribed, self-prescribed, how systems deal with reviews, how they, which resource types are being implemented for each of those types of meds. And then moving on to patient summary. So the medication section in patient summary has a choice, and that's between medication requests and medication statement. So potentially a discussion around dealing with duplicates, dealing with active meds, current meds. And just a reminder from what Danielle said, that there is a proposal for a medication statement profile going out. It's not going to be the focus of this workshop. That'll be separate, but it's more a how do we deal with those two types of medication resources, and potentially getting some guidance in the IGs around that. And then in the afternoon, the workshop will be focused on exchange of patient summaries. We're working through the referral consumer journey, and I'm going to get to that in a moment. And this is around a referral from a GP to a allied health, and also to another practitioner, and how patient summaries are exchanged. And in that workshop, we'll be talking through some of the considerations and challenges for each of the steps, what we need to solve those problems, any interactions, and again, potentially getting some guidance in the IGs around that. If you could go to the next slide, please, Tim. So the agenda for the day, as I said, a couple of workshops in the morning around medications, and then the exchange considerations and architecture in the afternoon. Yeah, maybe go to the next one as well. Okay, so I spoke about the consumer journeys. So there were 5 consumer journeys that were developed with the clinical focus group, using some technical use cases and around various clinical scenarios. And the purpose of those was to highlight the clinical workflows using patient summaries. There were 5 developed. A few meetings ago, I'm not sure the exact date, I think it was in November, 3 were nominated for development of the patient summary Fire RG. Those 3 were the interstate GP visit, the emergency hospital attendance, and the referral to specialist or allied health, or sorry, it's now called and allied health. And from talking to vendors over the past month or so who were able to support patient summary, the referral use case, which is the one on the screen, emerged as being the first one to focus on, because it's about people who can actually support something. We're going to be working on narrowing this use case down to a couple of the points. If you dive into this, it gets incredibly complicated towards the end, where we're talking about updates and multiple patient summaries potentially. So in order to keep the workshop focused, we're just going to be going on the first couple of steps, and we'll be talking about that tomorrow at the patient summary call. Okay, I think we can move on to the next one. Yep. Okay, and so we're putting another call out. We need you, if you have a system and you're willing to do a presentation on how you're representing medications in your system, again, for those same use cases, the different types of medications that can be in these different systems, working through those, and how you would implement or intend to implement those use cases in a Fire resource. Short demo, 5-10 minutes. I can connect with you through email or through another call afterwards, but if you can drop me a line, that'd be great. Next slide, please. And similarly for the exchange workflow, my kangaroo is faded. Again, a short presentation of your system for that particular consumer journey, which is the referral. So if your system does referrals, I'd really love to hear from you. Again, a short presentation, this time talking about some of the interactions between the actors. So actors being patient, GP, the receiving clinic, any clinicians that are involved along the way, the various requests that get sent around, what's in the data payload for the referral. So is it an embedded patient summary? Is it a link? Is there any sort of authentication? Just considering some of those points in that presentation would be great. Even if you don't have a patient summary, showing the referral exchange workflow would be great to see, because that'll help shape the workshop that afternoon. And next slide, please, Tim.
Yep.
So this is going out next week. A lot of pre-reading. I've linked directly to various pages, so you don't need to read the entire spec. It's just various pages. So specifically around medications in other IGs, so US Core, and also how medications are handled in IPS. There's some interesting guidance on the medication request US Core profile. There is some interesting content in there around the medications for the IPS. Being familiar with the content in our own specs, so AU CDI, AU Core, and AU Patient Summary, the draft that's up. Having a look at the different exchange operations that we've got in IPS and IPA. So the IPS dollar summary and the IPA doc ref, just being aware of those particular topics may come up on the day. So understanding what they're all about. And then for the consumer journey, I've linked in the referral to specialist consumer journey that we'll be looking at. So you can look at that in a bit more detail. And to bring along to the workshop your use cases for how you share medication information. So even if you're not doing one of those presentations for the session, if you can bring them along, then you'll be able to help guide the table through the different activities that we've got. And some other things, some ideas around what we might need to consider for the exchange of patient summaries, and a lot of that comes out of the IPS and IPA documents that we've got there that you can have a read through. And next slide, just again, as I mentioned earlier, we're at 101 tickets sold or tickets snapped up, and I think there's 19 left. So you can hit that QR code to get on the list. And that's me. Thank you.
Amazing. Thank you, Steve. Which brings us to the end of our technical design working group. If you have any questions, now's probably the time to ask them. If not, I wish you all a happy day. Danielle, did you want final words? Sure. Okay. Yeah. Have a great day, and yeah, we'll see you tomorrow, maybe, for those who are going to the IPS conversation. All right. Thank you very much. Have a great day. Bye.
Thanks, Tim.
Thank you.
Thank you.
Thanks, Tim.
That's good.
Just stop the recording.